Hey everybody, welcome back. My name is Dana Donifrey and I'm the CEO and founder of Ana Ono. And I'm so excited to bring back Dr. Claytor, who we did a piece on just earlier, or late last week actually, talking about the new standards for non-essential surgeries and how it relates to a recent breast cancer diagnosis. We're also going to be hearing from one of his incredible, amazing, beautiful patients, Anastasia, about her experience. And I just want to take a brief moment. Dr. Claytor, thank you so much for coming back to talk to us about this, and especially to kind of talk about a real life, real case scenario where a patient could normally encounter a delayed reconstructive surgery. So in a quick snapshot, we know there's a lot of women getting these calls right now from their breast surgeons and from their plastic surgeons that are telling them that their reconstructive surgeries are going to be delayed or postponed. And any cutting edge news that you know in the last 7 days that you want to share with these patients?
We are continuing to see an evolution of the coronavirus and the impact that it's having on resources. And while we have always maintained that breast reconstruction is not an elective procedure, but a main part of the entire process of fighting the cancer, I think you used the correct term when you said that it's not essential. And I think I would take that one step further and say that it's not critical to life-saving. And really, that's where we are with our resources right now. And so at our health system, we are not doing any of the autogenous or flap reconstructions. Those have really been put on the shelf, and things that we can come back to later, certainly. But at this time, achieving mastectomy and closure and trying to keep the patient's time in the hospital as short as possible. In terms of the expander or direct implant, those are really being looked at on a case-by-case basis in terms of evaluating the resources for the patient as well as the surge capacity at each individual hospital.
So this could really be affecting patients. Maybe if you were slotted for a mastectomy, you may be getting slotted for a lumpectomy instead. If you were a mastectomy with a flap reconstruction and you weren't already delayed, you might be delayed.
Yep.
Or if you were a double, you might be receiving a single, something like this, right? So the surgeries might be getting downstaged right now. But I think that's why, hearing about Anastasia's case, I think is going to be really inspirational and hopeful for so many, because I think she has a really unique story to the path of treatment and care that she went down even before COVID. So would love to hear your introduction of what we're going to learn today from the story of you and Anastasia.
Well, Dana, thank you so very much. I'm so incredibly honored to be involved in Anastasia's care, because she had a unique scenario, which actually is highly applicable to this period in time. Even though her surgery was a year ago, she, number one, was looking for an aesthetic result that really matched her goals. And one of those was maintaining nipple viability. And when patients have a certain anatomy that is not conducive to a direct implant or a nipple-sparing mastectomy, it's a very challenging scenario. And Anastasia was very open-minded to having an extra operation to achieve a lumpectomy, so clearance of the tumor, and then to undergo chemotherapy, but then have a staged mastectomy down the road once effectively she was cancer-free. And that also allowed us to do a procedure that could preserve her nipples. And so it was a multiple stage procedure. And that can be frustrating sometimes for people, because sometimes they say, can we do this all in one operation? And I think that absolutely the staged part of this allowed for that optimal result. And so how that pertains directly to the current scenario, as you pointed out, that if perhaps somebody was looking at a mastectomy, but could perhaps undergo a lumpectomy at this time, and then subsequent to this, once everything seems to have settled down in a period of time, which might be several months, to be able to come back and perform that lumpectomy conversion to a mastectomy, so that the ultimate procedure is the mastectomy. And that may even open up opportunities for nipple sparing procedures that may actually ultimately deliver aesthetic results that may be superior. So with that as the background, I think that Anastasia's opportunity to share her story is now.
And thank you, Anastasia, for joining us for this. I know it takes a lot of courage to get out there and talk about these very intimate details, but I do think that this is a really incredible path and opportunity that you had with underneath the treatment of Dr. Claytor. So tell us a little bit, let's back it up a little bit and just tell us a little bit about when you got your diagnosis and what did that look like for you?
Sure. Thank you guys so much for having me. So in October of 2018, I had just turned 26, and I was diagnosed with triple negative breast cancer. I had found it myself through a self breast exam. And, at that time, I didn't know, it was possible for a 20-year-old to have breast cancer or to be able to get breast cancer. And just, finding out that triple negative was the most aggressive type of breast cancer. So that was a pretty scary time in my life. Having all those appointments in the beginning is very, very overwhelming when anybody's diagnosed. But when I met Dr. Claytor, I scheduled for a double mastectomy, and I was going to get that in November of 2018. And then I found out that I had the BRCA1 gene, and I think that's when the plan sort of changed for my nipple sparing operation. And we did the lumpectomy first, and we did like partial reconstruction. So we sort of did a reduction with a lumpectomy. So that spared my nipple and then nipples. And then we went on and did chemotherapy. I started chemotherapy in January of 2019, and I finished in March of 2019. After that, I waited a little bit and I did my double mastectomy in May of 2019. So it was a process. We really spread it out, and I think every step of the way, I was a part of the decision making, and all of my doctors, talked to me, and I always had a ton of questions. They always had answers, and they really assured me of my plan of care, and really like the way it was spread out, I felt like it gave me enough time to heal. But I got my double mastectomy after chemo in May of 2019. And then I had my expanders in for quite some time. I think I had them in for like 6 months. And then I had my exchange surgery in October of 2019, which was this past October. And it was great. Like I'm all healed up. My scars are pretty healed well. And it definitely gave me the time to heal. So
I think that's, a lot of this, a very long story like this and treatment path is likely for a lot of patients. And real quick, Dr. Claytor, I think something that Anastasia just referenced that I would like for you to just quickly talk about is how she received a breast reduction and a lumpectomy at first. Because what size were you, Anastasia, before surgery?
I'm sorry?
What was your size before surgery?
Oh gosh, I was very large breasted. I think I want to say I was like a triple D, but I don't think that was correct. I don't think I was wearing the correct size, because I don't think many of us wear the correct size.
Most women don't. Dr. Claytor, can you talk a little bit about the lumpectomy reduction process?
Absolutely. Anastasia had a anatomy that would have qualified her for a breast reduction if she had wanted to opt in that direction, right from even notwithstanding her cancer diagnosis. So in patients that fall into that category, and there are a lot of them, a very large percentage of patients have anatomies such that if there was a desire to have a direct implant or a nipple sparing mastectomy, the anatomy is such that it would not be possible. And that's why a staged procedure with a lumpectomy and then that reducing lift at the same time, and a lot of times this is referred to as an oncoplastic procedure that can be performed at the same time as the lumpectomy. And so in terms of applying this to patients today, again, this is a conversation that would need to be made between the breast surgeon, breast oncology surgeon, and the plastic surgeon and the patient to really come up with that ultimate plan. But even in view of the current containment that we have on utilization of resources, a simple lumpectomy at this stage, and then moving forward with chemotherapy, with the understanding that a planned lift / ultimate mastectomy procedure in the future, because as you well know, usually with lumpectomies you get radiation. So the whole point of ultimately having a mastectomy is to obviate the need for radiation if possible. And that really can dramatically improve patients' overall softness of their breast if they are going to be getting a mastectomy eventually anyway. As it pertains to Anastasia's anatomy, a lift allowed us to have a subsequent mastectomy with the nipple now in the perfect position.
So Anastasia, let's wrap this up with you talking. How did it feel for you as a patient to kind of have that expectation of that double mastectomy very early on, but then talking with shared decision making with Dr. Claytor and then taking down a different path? How did you feel? How did you cope with that?
So I think it was just kind of, initially I went in to see him and I asked him about a nipple sparing mastectomy, and I was told it wasn't possible at first. And then when it changed, I was kind of, happy about it, just because I was able to keep a part of me that I wanted to. But things change all the time. Your care constantly, your plan constantly changes. I felt comfortable the whole entire time.
Would you give any advice to somebody, who's just getting that call from their doctor to say, hey, we're going to postpone your surgery? What advice would you give to those patients right now?
It's going to be okay. It's really going to be okay, and you're going to do great. And just because, it's postponed and you have to give it a little time, take that time for yourself to heal, and it's going to be done.
I think that's amazing, because what I'm really hearing from you is that even though this was kind of spaced out, it gave you moments to breathe amongst the madness. And in the long run, that might have been the silver lining here, that you got to breathe and encounter every phase of the process.
It really did.
Yeah. Well, thank you both so much for helping these patients out there that are getting these dreadful phone calls and, really having to fight with the level of expectation that we all have when we're getting treated and cared for during a cancer diagnosis, even among this crisis. So if you have any questions or have any thoughts or have an upcoming surgery that's been postponed, but you are wondering what you can be doing in the meantime or how to change your path, if you have any questions, please leave them below in the comments. Anastasia and Dr. Claytor are both tagged here, so if you want to reach out to them or reach out to us, we'll do our best to get all the answers for you. And please stay safe, stay healthy, stay kind. Thank you so much. Bye, guys.
Thank you, Dana.
Bye.